Well, did you know that 1 in 13 kids suffer from a food allergy? It's so important to know and to be aware that these kinds of allergies, are so common and can have really severe reactions.
Today we are here with Rachel and Leslie from Monroe Carroll Jr. Children's Hospital at Vanderbilt. Now, May hosts Food Allergy Awareness Week. So we want to know, are there certain food allergies that are more common than others?
Yeah, there are what we call the top 9, which are the 9 most common food allergies. That is egg, milk, all types of dairy, peanut, tree nuts, wheat, fish, shellfish, soy, and then most recently, sesame.
Ooh. Oh, my, yeah, that's right.
It's a test. Wow, that's a lot. Okay, and you have a challenge coming up.
Yes.
Something about the top 9.
Yeah. So several of our staff members are participating in what we call the Top 9 Free Challenge. That is where you try to go the full week or a day or a meal without eating any of the top 9 allergens. And that can be pretty tricky when you think about how many things have milk in it that you're not aware of, or soy or wheat. And then it even kind of compounds when you think of tree nuts is one of the top 9, but you're talking about almond and cashew and hazelnut and walnut as one of those tree nut categories.
Okay, so what's the challenge and how do we become part of it? Yeah. How do we jump in on this?
Yeah, so trying to avoid the top 9 allergens. If you feel real strong and confident, go for the whole week. But you can even do as little as a day or a meal, and just kind of thinking about how hard that is and how that's a reality for a lot of kiddos.
Yeah. It's like an elimination diet, but just for a week, so testing things out.
Okay, so how do we know, and I'd love to ask you, I have a baby, I want to make sure I want to try to introduce allergens to her early so she doesn't have allergies later on. How do you know if your kiddo's going to have allergies or does, and what do you do at that point?
Well, so you're not going to know ahead of time, probably, if someone has an allergy. There's certain risk factors that make you more likely, like having someone in the family with food allergies or having severe eczema. But if you suspect that you have an allergy or your child has an allergy, seeing a board-certified allergist immunologist is really a good idea. We can do testing, take a detailed history, see if we think that that's consistent with an allergy, and then consider skin and blood testing to determine what you are allergic to, if you are allergic, and then provide you with epinephrine auto-injectors, which can be a life-saving device if you did have a reaction that's severe. And just provide guidance on how to avoid these foods. For many years, we could only avoid these foods, and that was our only recommendation, was just to strictly avoid. But now we actually have 2 FDA-approved products for the treatment of food allergy. And unfortunately, it doesn't make the allergy cured and go away completely, but makes it so that you're less sensitive to something if you were to eat it and have a reaction.
Okay, wow. And this is so important too, by the way, because they say that every 10 seconds, someone is admitted to the emergency room because of a food allergy. Now, what are some of those symptoms? Because it can be all across the board of a food allergy and what happens when you do eat some of these foods.
So with a true antibody-mediated food allergy, you may have a milder reaction that could be a skin reaction only, like hives or some swelling that's not like inside the mouth, but more severe reactions can happen too, with vomiting or trouble breathing, coughing, wheezing, or feeling like your throat is closing up, and those indicate a severe reaction.
Oh, wow. Oh, my goodness. Now, is there anything you can do to try to help prevent kids from having allergies?
So we know from studies that early introduction of typical food allergens such as peanut and egg have been shown in studies to be helpful in preventing allergy in a subset of people. So that's why you might find your pediatrician now recommending to feed your child peanut at an early age.
Okay. That's exactly what you were doing,
Oh my gosh, I know, because it's really scary.
Yeah.
You just don't know who has it and who doesn't until you try. And then obviously you don't want to land into that situation. But
Very
thank
good
you
information.
so much.
Thank you, ladies.
Really appreciate it. For more about allergies and to make an appointment to get all the answers your family's been looking for, visit childrenshospitalvanderbilt.com.